This video is about a process I call active prehydration, which is supposed to be a tool to help you achieve one of our typical recommended goals of avoiding drinking with your food. I've got to say that after a habit of regular exercise, implementing the habit of eating dry after bariatric surgery is one of the biggest challenges, yet one of the most important habits that bariatric surgery patients encounter. Americans are used to having something to drink with their food. Take a bite, wash it down, take another bite, washy slushy, basically turn your food into soup. And I don't suppose anyone planned it this way, but it makes your meal quicker and more efficient, but not necessarily more satisfying or more enjoyable. We're so used to it, we assume that we need to drink with our food. But think about it. Do we really think that our caveman ancestors had a cup or a nearby stream when they were eating the antelope that they just killed or pulled the meat off the cook fire? I don't think so. So I'm John Pilcher. I'm a bariatric surgeon in San Antonio. This video is mainly intended for the patients of our practice at Sage Bariatrics, but I think these ideas are going to fit with the majority of bariatric practices across the country. I hope this is useful. First, I want to clarify what we mean and what we're recommending when we talk about separating fluids from food. Then I'm going to talk about why we think that's important, and then I'll circle back to this tool of active prehydration so that we can make that as easy as practical. And yes, this video is mainly for my bariatric surgery patients, but it's not a bad habit for everyone, in my opinion. I do this myself, and I think it's pretty useful. So here's the guideline. We recommend that it's helpful to actively hydrate right up until you begin eating. We recommend to stop drinking once you take the first bite of food, then no fluids until an hour after the food intake is complete. And many folks hear this as, okay, no drinking 1 hour before, then you eat, and no drinking 1 hour after. But for reasons we'll discuss, we actually support drinking right up until you start that first bite of food. So just once again, drink up until eating, eat without drinking, and then no drinking for 1 hour after you finish eating. Why do we recommend not drinking with your food? Well, in the first few weeks, the little stomach pouch is kind of sensitive or resistant, and the food will tend to sit in the little stomach pouch, and if you drink fluid on top of that, then the fluid is not going to have anywhere to go. It will create an overpressure situation, it'll back up, and you'll throw up. And it's not going to cause damage, but it's ugly, and it's not a good habit. For the rest of your life, it's the opposite problem. In the long run, we don't want to turn every meal into soup because soupy fluids empty out of your gastric pouch too quickly. Our goal is for you to take a bite of some solid food, let's say chicken for example, to chew it for a long time, and imagine you don't have any extra water to wash down big chunks. So you're going to get all the taste out of that chicken, you're going to chew it very thoroughly, and then to have that solid meal rest in your pouch for a while, emptying only gradually out of your stomach pouch. And that little stomach pouch actually has fullness nerves that send satiety signals up to your brain, and the longer the food rests in the little stomach, the longer you'll go on your day without food noise. Okay, so once again, to not drink with your food will slow down your eating process, give you more of a chance to notice when you're full, it'll give you more chance to appreciate the food and the taste of the food, and it'll give you longer lasting satiety after your meal is complete. So I want to address two common complaints about this plan. Number one, some people talk about discomfort with chewing and swallowing, and number two, people describe some discomfort or some difficulty with hydration. About potential challenges with chewing and swallowing, I really believe that with some practice, we can turn these factors into true advantages for your metabolic health. If we're not going to soupify the food to facilitate swallowing, it'll become necessary to take smaller bites, to chew for a longer time, and to fully lubricate the food with saliva. All these things point toward more conscious eating, more appreciation of the food and the company, and better awareness of satisfaction level to comfortably stop eating. Now, if your concerns about hydration are coming from a place of difficult hydration, meaning that fluids aren't going down well, that's a different conversation, and you should probably reach out to your bariatric team for troubleshooting. All I'll say here is to emphasize that day in and day out, hydration is a bigger priority than food. If you have to make a choice between hydration and food, then take the fluids. Now, more commonly, my patients are just trying to plan their day to manage hydration around work and other activities, and this is where I'd like for you to plan on active prehydration. Active prehydration means that when you're coming up on a meal, you spend the last 20 or 30 minutes getting 12 or 20 ounces of fluid into your body before the meal begins. You're drinking briskly, not quite chugging, so drink drink, and this pre-drinking has two benefits. One thing is you're taking care of your hydration needs for the next couple of hours, so you're not going to feel thirsty after you eat. And number two, this brisk, not quite chugging drinking is going to put a little pre-stretch on your stomach pouch so that those same nerves of satiety are going to be activated, take the edge off your hunger, and you're going into your meal, going into the actual food part with the edge taken off of your hunger. So you can eat fully under control instead of feeling ravenous. Now imagine a family dinner at a restaurant, or maybe it's at home, and you're prepping the food, you're setting the table, and you're drinking. You sit down, you're chatting with the family, food's coming to the table, and you're drinking actively, almost chugging, okay? You finish all the prep, you finish all the conversation, time for eating. As soon as you pick up the fork, you push that glass away, and you don't pick it up again until an hour after the meal is done. Sound good? So one related question, what about straws? For me, straws are okay, but I want you to get advice from your bariatric team. And I've got to say it again, separating eating and drinking shows up over and over again as a core habit for people who gain and retain their metabolic health. Cheers.